Hello and welcome to our monthly teleconference series. Today's topic is prediabetes, brought to you by Northern Westchester Hospital. My name is Margaret Robato and I am a registered nurse and educator for the Community Health and Education Outreach team. I would like to introduce Pat Talio, a registered dietitian and certified diabetes care and education specialist. Pat Talio is a registered dietitian with over 30 years of clinical experience. She received her Bachelor's of Science in Food and Nutrition from the University of Rhode Island, completed her dietetic internship at the New York Hospital Cornell Medical Center, and received her Master's of Science from New York Medical College. Pat also maintains a credential as a certified diabetes care and educational specialist. So let's get started with the presentation. Welcome, Pat.
Thank you. Good morning, Margaret, and good morning, everyone. I want to first begin by thanking Margaret for inviting me. And more importantly, I want to thank all of you for taking valuable time out of your day to listen to me. Without all of your ears and your participation, we honestly wouldn't be able to conduct these really important webinars. So thank you.
Thank you, Pat.
Oh, you're welcome. I first want to say, when you hear the term prediabetes, or when people hear the term prediabetes, I could imagine some people are relieved. They may say, whew, I don't have diabetes, prediabetes. And then there are other people who become scared because diabetes is in the diagnosis in the term prediabetes. So I'm hoping that this talk will help clarify some of the questions you may be having and maybe clear up some of the misconceptions you may have if you're diagnosed or know somebody that has been diagnosed with prediabetes. I want to start off with some statistics. The key findings from the National Diabetes Statistic Report from 2020 show an amazing number of people, 34.2 million Americans, just over 1 in 10 people have diabetes. Of the adults diagnosed with diabetes, there is some good news because new cases of diabetes significantly decreased from 2008 to 2018. And this is my own personal opinion, but I do believe that the initiation or the diagnosis of prediabetes may have helped to reduce those numbers. And hopefully through this talk, you'll understand why I say that. Of the people that were diagnosed with diabetes, 15% of those people were smokers, 89% of those people were overweight, and 38% of those people were physically inactive. So now getting to prediabetes, 88 million Americans, adult Americans, approximately 1 in 3 have prediabetes. The scary part of that is that 84% of those that have prediabetes don't know they have it. The percentage of adults with prediabetes who are aware of the condition actually has doubled from between 2005 and 2006. But like I said, 84% still do not know they have prediabetes. So that's astonishing and it's very scary. Let me explain some terminology before we go forward. When you go into the doctor's office and you have blood work done for your annual physical, most of the time, I would say probably 100% of the time, you have something drawn called a fasting blood sugar. And what that means, what that fasting blood sugar is the blood sugar number at the time of that visit. So most of the time, your physician will ask you to go into the doctor's office when you have your blood work fasting. And what that means is that you don't eat anything for 12 hours before that test is done, what I would caution is a lot of times, sometimes what people will say is, well, he told me not to eat for 12 hours. I'm going to not eat for 14 hours or more, thinking that you're doing yourself a service. But I can tell you, fasting of 12 hours is appropriate. You should not fast for more than 14 hours because you could actually end up having a false positive or a higher blood sugar number by fasting too long. So that's really important. So just to reiterate that point, a fasting blood sugar number is the blood sugar number at that moment of that test. And you should fast for 12 hours, but no longer than 14 hours. The other term or the other test I want to talk to you about is something called a hemoglobin A1C. The hemoglobin A1C is kind of a tricky number. It's a tricky number because it's not the blood sugar number at that time of visit like the fasting blood sugar is. The hemoglobin A1C is actually an average number. It's an average number. It's tricky in the sense that it gives the physicians an idea of what your blood sugar on average has been like 3 months prior to that test. So now that you kind of have an idea of what those numbers are, let me explain the numbers. What do the numbers mean? The American College of Endocrinology, who are at the forefront of the diagnosis and the treatment of diabetes, as well as the American Association of Clinical Endocrinologists, set the standards. If a fasting blood sugar is less than 100, that's considered normal. If the fasting blood sugar is greater than or equal to 126, then that person does have diabetes. Then the blood sugar, the fasting blood sugar between 100 and 125, that's termed pre-diabetes. So you don't have diabetes, but you are more likely to eventually have the diagnosis of diabetes. And I'll get into that for a little bit more. When we talk about that tricky test, that hemoglobin A1C, a normal reading is under 5.7. If you have diabetes, that number is greater than or equal to 6.5%. And the number in between 5.7 and 6.4% is termed prediabetes. So what is this? What is prediabetes and what causes prediabetes? You have an organ called your pancreas, and your pancreas secretes a hormone called insulin. Insulin is a really important hormone, and there's really no other hormone that your body secretes that does what insulin does. Insulin is like a key, and what it does is it's a key to helping blood sugar that forms in your body. It lets that blood sugar into your cells. And the reason why that's important is because blood sugar or blood glucose is the main energy that our body uses. So insulin is the hormone that allows your body to use the blood sugar for energy. So if you have prediabetes, what that means is the cells in your body aren't responding normally to insulin. And what we call that is something called insulin resistance. So your body is secreting insulin, your pancreas is secreting insulin, the cells in your body aren't responding normally to insulin. And it's very common as we get older for this phenomenon to happen. So your body is not responding normally. And what the pancreas does, it says, the insulin isn't working normally, or your body's not responding to the insulin normally. I'm going to start secreting more and more insulin. So your pancreas secretes more and more insulin to try to get the cells to respond. Eventually, the pancreas can't keep up with it, and the blood sugar continues to rise, setting the stage for prediabetes. at that point, when you're diagnosed with prediabetes, what you want to do is you want to take advantage of that and work on an intervention or work on lifestyle changes. And again, I'm going to talk to you about that, because that prediabetes is setting the stage, or it's telling you, hello, you may end up with a diagnosis of diabetes. So it's kind of like a warning signal. A little bit of trivia. In 2003, the diagnostic criteria for diabetes was lowered. So before 2003, if you had a fasting blood sugar of 139, say, you were not termed to have diabetes. So it was lowered from 140 to 126. And the normal fasting blood sugar was lowered to less than 100. So what that did, by lowering the diagnostic criteria for diabetes, what it did was it created this new category, which we're talking about today, called prediabetes. So what people have said to me in the past, I mean, I've been around a long time. I hate to admit it, but I've been around a long time. And when this new category was, this diagnostic criteria was created, I heard people say, wait a second, a couple of years ago, if I had this same number, I would have no problem. I wouldn't have been diagnosed as prediabetes. I would, I'd be fine. My argument to that is, this is an ounce of prevention. An ounce of prevention is worth a pound of cure. So if we can then prevent someone from going to diabetes with this warning of prediabetes, that's a win. That is a win. So the good news is that if you've been diagnosed with prediabetes, you now have an opportunity to take a look at your diet, to take a look at your lifestyle, and hopefully make a change to avoid the diagnosis of diabetes. Prior to the inclusion of the diagnosis of prediabetes, there was no warning. If you think about the statistics that I mentioned earlier, 84% of people walk around without knowing they have prediabetes. Prior to the diagnosis criteria of prediabetes, people walked around not knowing they had diabetes. So thanks to this new criteria and the diagnosis of prediabetes, we could really work on some prevention, some lifestyle changes. So what I say also is, be not a statistic. According to the American Diabetes Association expert panel, up to 70% of individuals with prediabetes will eventually develop diabetes. Without lifestyle changes, 15 to 30% of people with prediabetes will develop type 2 diabetes within 3 to 5 years. Again, my response is, try and delay it for as long as you can. It may be in your genetic profile, and regardless of lifestyle changes, you may not be able to prevent it, but you may be able to delay it as long as you can by making lifestyle changes. So I'm going to just take a little sip of water, and then we're going to talk about what are the lifestyle changes to make. Okay, so what are the lifestyle changes? There is definitely a clear relationship between weight gain in adulthood and the development of diabetes. For every 2 pounds increase in weight, there is a 9% increase in developing type 2 diabetes. The greater your body mass index is, the greater your risk of developing diabetes. So there is definitely a relationship between weight and developing diabetes. On the other hand, moderate, sustained weight loss has the potential to reduce the risk of diabetes and actually help improve that insulin resistance we were talking about. statistics show, so some people will come in and they'll say, this is what I weigh. If I have to get down to what that chart tells me to get, forget it, I'm never going to be able to do it. That's actually not what we're saying. When you're diagnosed with prediabetes, if you are overweight or if you're obese, statistics show a 10% weight reduction at diagnosis of prediabetes regresses the progression. So 10%, we're not talking about looking at that chart and trying to, aim for what you weighed in high school. That's not what we're talking about. We're talking about a 10% weight reduction at diagnosis. Okay, so, all right. All the professionals tell me I need to lose weight. It's easier said than done, right? I mean, it's so easy to say lose weight, lose weight, lose weight. But it's not easy. I understand that. It is not easier. It's easier said than done. So I'm going to give you some tips that I would give you if you are coming into the office. The first thing I would say is really take a look at your diet. Examine what you're eating. If you know you're eating more sweets than you really ought to, or if you're choosing, the white bread and the white pastas and the white rices over more of the whole grains, I would say try to make that change. Try to avoid the sweets, especially if you're having, come 3 o'clock, 4 o'clock, we all get that little hunger. It's been 3 hours since we ate lunch and it's going to be another couple of hours before we eat dinner. We're hungry. If you're reaching for something sweet at that time, that's a mistake. If you say, you know what, I don't have diabetes, I have prediabetes, I don't want to give up my sweets, what I would suggest to you is if you wanted to have something sweet, even if we're talking about a little bit of fruit, try not to have it all by itself in the middle of the day. Try to keep the sweets as a dessert. So if you do not want to give up the sweet, and you want to have something that is a little bit sweet, keep it as a dessert. Don't have it in the middle of the day, or especially not at breakfast when you're more insulin resistant. So if you can avoid the sweets, wonderful. If you can't avoid the sweets, try to keep it as a dessert, not by itself in the middle of the day or at breakfast. And try your best to reduce the refined carbohydrate, meaning the white stuff. So what you might want to do is if you're a white rice kind of person, maybe mix it up and add a little bit of quinoa in with the white rice just to up the fiber. So when you think about the carbohydrate in your diet, we talk about quality of the carbohydrate as well as the quantity of the carbohydrate. I do not believe in carbohydrate starving. I do not believe that when you're diagnosed with prediabetes or if you have a family history of diabetes, that you should starve yourself of carbohydrate. That does not work. What I do say is think about the quantity, how much are you having, and what is the quality like? How much fiber is coming from that carbohydrate? Because the fiber from the carbohydrate, the fiber from the starchy stuff in your diet really makes a huge difference in blood sugar control. So what that means is if you're in the grocery store and you're looking to buy rice or pasta or any kind of starchy food, crackers or cereal or bread, instead of looking, a lot of times people will look at the total carbohydrate and they'll look at the sugar. Great, be aware of what's on the label, but what I want to do is educate you on knowing that the fiber in those things is really what you need to look at. So if you're comparing rices, if you're comparing breads, compare the fiber and choose the one with the highest fiber. Another tip that I would suggest to you is dine out, or with the pandemic in mind, take in less. When you eat at home, you control the ingredients, which is super important. If you eat well, and the majority of us do, take a look at your portions. Use a smaller plate to control your portions and double up on the veggies. Today, a lot of people will try to cut the carbs, and in cutting the carbs, they increase the protein. So they'll say, you know what, I'm not eating the rice, I'm eating lots of chicken and lots of fish. What I would challenge you to do is try not to increase your protein when you reduce the carbs, increase your vegetables, because honestly, protein and carbohydrate have the same calories. So if your goal is to lose weight, by increasing your protein when you reduce the carbohydrate, it's almost like you're on a treadmill. You're walking really fast and you're not really going anywhere, you know? So you want to up the veggies and reduce the protein and carbohydrate. Sometimes people will try fasting, what we call intermittent fasting. So my take on this is, if you want to try fasting, you can try fasting. What I would suggest first is try like a 12-hour fast. So if you eat dinner at 6 o'clock, you won't eat breakfast until 6 o'clock. That's not a hard thing to do. If that's really what you're already doing, maybe try 14 hours. But the caveat is, what sometimes happens is by doing that fast, you end up eating more later on in the day. So if it's not helping you cut calories and it's just making you hungry and miserable, it's not worth it, so forget it. What you can also do is eat carbohydrate at only one meal per day and make that the meal that you're most active. Again, I don't believe in carbohydrate starving. I do believe sometimes by carbohydrate starving, you end up causing your blood sugars to be higher. So that's not what you want. Another key is to self-monitor. You know, sometimes when we know our weight is up, what do? We don't jump on the scale. We say, I know I'm gaining weight. I'm not going to weigh myself. I know. I can see all of your eyes rolling. You need to monitor. You need to weigh yourself. I wouldn't get on and off the scale every day, maybe weekly, maybe monthly, whatever works for you, but you definitely need to keep an eye on yourself. The other way you can self-monitor is keep a food journal. A paper journal is fine. And the other key to the journal is use it when it's most beneficial. If you're doing great, you're eating a really good breakfast, you're eating a great lunch, you do well with dinner, you don't need to record all the foods that you're eating. If you know that after dinner is a time when you're kind of like looking around for things, you're opening up the cabinets, you're opening up the refrigerator, keep a blank piece of paper on the counter in the kitchen. Every time you go into that kitchen, write down what you're eating, because then what ends up happening is you become more conscientious and you become more mindful of what you're eating. Don't look to fad diets. Fad diets work for a short period of time. This is lifestyle changes. This is something that has to be sustained. This has to be a weight loss that you're able to achieve, that you're able to maintain over the long haul. So the key is looking at your portions and making healthy choices. Eat more slowly too. That sometimes helps, and sometimes if you eat smaller amounts, maybe you introduce a healthy snack so that helps to keep the portion controlled. The other real key to all of this is you have to move more. If you're moving already, great. If you're walking, whatever you're doing, if you're gardening, if you're playing golf, whatever you're doing, that's great. But add 5 more minutes. You know, if you're moving, great, but challenge your body. Make sure and of course, as long as your physician has said it's okay, but add 5 more minutes. It's recommended that we move 150 minutes per week of moderate exercise, which is walking. So maybe you say, you know what, I don't need to lose weight. My weight is good, and I'm still being diagnosed with pre-diabetes. Now what? Look at the quality of what you're eating, meaning, again, if it's white, it's not right. Switch up make sure you're getting adequate fiber. Make sure that if your weight is good, and you're snacking on fruit between meals or after dinner, you change that up. If you can tolerate a handful of nuts, that would be great. Or add some nut butter to the fruit, or really a low-fat piece of cheese with the fruit. That would help slow the absorption of the sugar from the fruit. Don't make light of the diagnosis of prediabetes, but also don't be scared. You want to be honest with yourself and listen to what your physicians are saying, and if they're recommending a lifestyle change, try not to deny what's going on and try to be honest with yourself. I do have a bit of local good news. My alma mater, New York Medical College, is on the forefront of diabetes research. There's the dean of the School of Medicine over at New York Medical College, Dr. Jerry Nadler, received a grant from the NIH, and he's continuing his research. He's got a research going on with investigators from Harvard and from the University of Chicago Medical Center. What he's doing is he's studying a link between obesity, diabetes, and heart disease to identify a new target for treatment to preserve the beta cell function. The beta cells are the cells within the pancreas that secrete that insulin. So he's working on treatment to try to preserve that beta cell function of the pancreas, which would help to reduce the incidences of diabetes and also help to reduce heart disease. So I wanted to end on a hopeful and positive note. But I do believe that lifestyle changes are really at the forefront of preventing the progression of prediabetes to diabetes. I worked with an endocrinologist many, many years ago who used to say, diabetes is in our evolution. So if you are diagnosed with diabetes at 60, that's probably in your genetic profile. But if you could prevent that diagnosis at start and regress it, that's even better. It's in our evolution, but it is something that we could prevent or at least delay the onset of the diagnosis. Thank you so much for your time today. I so appreciate it.
Pat, it's such a wonderful presentation. I can't thank you enough. A lot of great tips and hints and information that I think people can really put into place to help themselves live healthier lives, especially if they're diagnosed. Just one quick question. When you're saying that 84% of people are even unaware of the diagnosis, is that because they're not being properly screened?
It could be that they're not properly screened, or they've been screened and they're not being told that they have prediabetes.
Okay.
So it's something that I think people need to, when they go in for their physical, say, what does my blood work look like? I don't have diabetes, but what is that blood sugar? What is that A1C? And I think the more educated we can become regarding this, I think it's only to our benefit.
Terrific. So, information when we're speaking with our doctor, make sure that we want to be, if we have a history of it in our family, or if we know that we've sort of been gaining those few pounds that you're saying, that we ask for feedback on things like our blood sugar and our A1C.
Absolutely. Absolutely.
Okay. Terrific. Well, we've come to the end of our session. I could ask you more questions, but we're already 11:30 and I don't want to hold people longer. Pat, thank you so much for sharing your expertise with us. And I want to thank all of you attendees who have joined us today for our third teleconference. I hope you enjoyed it as much as I did. Please remember to call in every month on the last Wednesday at 11 a.m. The new call-in number that you dialed in today is the same one that will remain going forward. Next time, on March 31st, I'm sorry, I apologize, in April at 11 a.m., we will discuss what you can expect now that you are vaccinated, and safety information regarding gathering and travel with Dr. Deborah Spicehandler, who is a co-chief of infectious disease here at Northern Westchester Hospital. Thank you all very much and be well.